Good morning. Welcome to the February meeting of the Carter Center Board of Councilors, our first one for 2021. I am Sham Reddy, and I chair the Board of Councilors. 2021 marks 34 years for the Board of Councilors and 39 years since the founding of the Carter Center. Thank you for standing by the Carter Center since 1987, for bringing guests with you and promoting the Carter Center's work and mission to wage peace, fight disease, and build hope. And in a moment, we'll welcome the newest members of the Board of Councilors, many of whom are watching the broadcast today. This is our third virtual meeting, and while vaccines are being used to combat the COVID-19 pandemic, we expect our next couple of board meetings to be virtual as well. Even in a virtual format, we are staying close to our standard meeting model and have a fine group of speakers, including Carter Center CEO Paige Alexander and Carter Center Board of Trustees Chair Jason Carter, and three very compelling presentations. As always, we welcome first the members of Atlanta's diplomatic community. We are so honored to have several consuls general and honorary consuls with us virtually, and we look forward to introducing each of them by name the next time we can gather together in person. And as they were encouraged to do, our members have invited many guests to our virtual meeting, and we welcome them all from wherever they hail from across the world. President Carter recently asked several new members to join the Board of Councilors, and I am so happy to introduce those who have accepted the call to serve as our newest councilors. Brad Alexander, a partner with Impact Public Affairs. Sue Belke, President of Asset Intelligence Informa. Shalia Forte, Director of Southeast of Pandora Radio. Dr. Janine Franco, the Village Vets of Decatur. Joe Chiani, the CEO and Chairman of the Board of Massimo Corporation. Lara Nador, the President of CHEP North America. Amol Naik, a Principal at Squire Patton Boggs. Jason Perry, the Office Managing Partner at Grant Thornton. Mark Perung, President of Atlanta Beverage Company. Dr. Praveen Reddy with Reddy Aesthetic Institute. Sachin Shailendra, the President of SG Contracting. Fahim Siddiqui, the Senior VP of Information Technology at the Home Depot. Laurie Speed with Speed & King Law Firm. John Tien, Managing Director at Citigroup. Carol Tomei, the Chief Executive Officer at UPS. William Vogel, Managing Principal at Montag & Caldwell. And I'm delighted to introduce our two newest life members to the Board of Councilors, and they are Dot Pageant and Jerry Rosenthal. Congratulations and thank you for your service on the Board of Councilors and your support for the Carter Center. A big welcome to our newest members. I have only one item of board business today, particularly for our new members and also for our guests. I want to explain that the program we will see today is standard for our virtual meeting and closely models the Board of Councilors' famous in-person breakfast meetings. This morning, we will hear presentations about three of the Carter Center's dozen or so programs and initiatives. We will hear from the Carter Center CEO, Paige Alexander, and Chair of the Carter Center Board of Trustees, Jason Carter. And we will direct a couple of video questions to both Paige and Jason. At our next meeting in June, we will hear about 3 or 4 different programs and so on at future meetings, so that over the course of a year and over the course of your term, you will become an expert on the center's work of waging peace, fighting disease, and building hope. With this knowledge, members and guests are encouraged to spread the word of the great work of the Carter Center. On our agenda today, Dr. Gregory Nolan, Director of the Lymphatic Filariasis Elimination Program, will report on progress against lymphatic filariasis and malaria on the island of Hispaniola, shared by both Haiti and the Dominican Republic. Then, Laura Newman, Director of the Rule of Law Program, will preview the Inform Women, Transform Lives campaign. Then Nathan Stock, consultant to the Conflict Resolution Program, will speak on the Center's violence prevention work around the U.S. elections. Finally, in the second half of our program, Carter Center CEO Paige Alexander and Carter Center Trustees Chair Jason Carter and I We'll discuss the opportunities and challenges that the Carter Center faces and take questions from members. Now, to our first speaker. Dr. Gregory Nolan, in 2020, was named director of the Carter Center's River Blindness Elimination Program, the Lymphatic Filariasis Elimination Program, and the Schistosomiasis Control Program, as well as the center's Hispaniola Initiative. Dr. Nolan joined the Carter Center in 2011 as an epidemiologist for the center's Malaria Control Program. Before that, Dr. Nolan worked as a project manager for the University of Minnesota Malaria Research Program in Kenya. And prior to that, Dr. Nolan was a guest researcher at the U.S. Centers for Disease Control and Prevention's Division of Parasitic Diseases. Greg earned his bachelor's degree from Davidson College, and he earned a doctoral degree in molecular microbiology and immunology from Johns Hopkins University's Bloomberg School of Public Health. And he holds a Master of Public Health degree in global epidemiology from the Rollins School of Public Health at Emory.
Thank you, Sham. First, let me begin by thanking all of you listening this morning for your interest in and support for the work of the Carter Center. This morning, I'd like to share about our efforts to eliminate lymphatic filariasis, or LF, in Hispaniola. Lymphatic filariasis is probably an obscure disease for many of you. It's a parasitic infection transmitted by mosquitoes that affects an estimated 120 million people in tropical and subtropical areas. It was even known to occur in Charleston, South Carolina, up until the early 20th century. The adult parasites inhabit lymphatic vessels, causing dysfunction that can lead to massive swelling of the legs, thus giving rise to the common name for the disease, elephantiasis. This largely irreversible condition brings physical pain, as well as stigma and social exclusion from having big leg, shunned from family, friends, spouses, even the marketplace, as people believe the goods you sell are also poisoned or cursed, just like you. So in many ways, those who suffer from LF also suffer in obscurity. In the Americas region, only 4 countries, Haiti and the Dominican Republic, who share the island of Hispaniola, along with Brazil and Guyana, remain endemic for LF. The goal of the Carter Center's Hispaniola Initiative is to assist the Ministries of Health in Haiti and the Dominican Republic to eliminate LF as well as malaria from their shared island. This photo shows President Carter meeting with the heads of state in both countries in 2009, soon after the launch of the Hispaniola Initiative. At baseline, around the year 2000, mapping studies revealed that all of Haiti and 3 major areas in the Dominican Republic were LF endemic and in need of mass drug administration, or MDA, to prevent transmission. A true drug combination of albendazole, donated by GSK, and diethylcarbamazine, donated in recent years by Asahi Pharmaceuticals, given once a year to the entire population in endemic areas for at least 5 years, is predicted to break LF transmission. Before turning to Haiti, let me quickly highlight the progress in the Dominican Republic. As of 2018, each of the 3 formerly endemic areas have stopped MDA for LF and are now in the 5-year post-treatment surveillance period required by the World Health Organization. The Carter Center provides assistance to the Ministry of Health to conduct post-treatment surveillance surveys and to prepare their dossier for submission to WHO for validation of LF elimination by 2023. In Haiti, 86% of districts have also met criteria to stop MDA and enter post-treatment surveillance. A great achievement, no doubt, and a testament to the handful of partners like CDC who have supported the program from the beginning. But the job isn't finished, not for those of us in the elimination business. The 19 districts, those shown in red in this map, remain in need of MDA to break LF transmission. This is perplexing because some areas have received many more than the 5 years of treatment. For example, Leogán, just to the west of the capital Port-au-Prince, has received 17 years of annual treatment. So what's going on in these areas? Why is an effective drug not breaking transmission? Well, one of the reasons is that the drug doesn't work if people don't take it. As you can see in this chart, historic annual treatment coverage in Leogán has generally only hovered around 65%, the minimum level recommended by WHO. And in fact, in 2018, only 62% of the population was treated. In other words, each year 35 to 40% of the population is not treated. And studies have confirmed those who are not treated are more likely to be infected. So it's no surprise that transmission continues in these areas. After the 2018 MDA, the Haitian Ministry of Health asked for the Carter Center's assistance to improve drug coverage. And we, in turn, reach out to Dr. Jim Lavery, an expert in community engagement at Emory University. His team spent several months interviewing program staff and learning about MDA campaigns. Much of the investigation focused on the design and operation of drug distribution posts, such as the one shown in this photo. Trained community volunteers are stationed across the city asking passersby to stop and consume pills to treat LF. Would you stop and take pills? I know I probably wouldn't. I'm in a rush to get home. I took the medicine last year, maybe the year before that. And what is LF anyway? So one of the key recommendations from the Emory team is that we need to pay attention to the consumer experience. In other words, take a business approach, treating the consumer more like a customer. We began implementing recommendations ahead of the fall 2019 MDA, which was delayed until early 2020 due to political instability in Haiti. We saw a 14 percentage point increase in drug coverage from 62% to 76%, and then a further increase to 79% in the December 2020 MDA. This year, we will extend our efforts by identifying and working collaboratively with systematic non-compliers to learn about the reasons for not taking treatment and co-developing strategies that address these concerns. In addition, we have received a grant from the Gates Foundation to partner with 2 software companies to improve the microplanning and operational management of MDA campaigns. For example, instead of conducting a time and labor-intensive door-to-door census to determine the treatment population for MDA, our collaborators can derive highly accurate population estimates from publicly available data sets. We then use these data to define treatment zones for each distribution post, shown here in red, for MDA teams to accurately plan and manage supplies for the week-long campaign, and to make sure that no neighborhood is missed. And finally, while MDA prevents new infections from occurring, we can't forget those who already suffer from lymphatic filariasis. In Haiti, there is only one facility across the entire country currently providing specialized care for LF patients. So this year we initiated trainings to expand the number of referral centers in the country. And we are also collaborating with our mental health program of mental health care to reduce depressive symptoms that are so prevalent among LF patients, with results from this year-long trial soon to be available. So let me conclude there and say, on behalf of the future generations who will no longer face the threat of lymphatic filariasis, I thank you very much for your attention.
Thanks, Greg. It's so great to see a fellow Rollins alum doing important work in your fields of expertise. I'm looking forward to seeing you continue to do great work over the coming years. Laura Newman joined the Carter Center in 1999 and now serves as director of the Rule of Law program, overseeing information, accountability, and justice projects in Latin America, Africa, and Asia. Ms. Newman has served as a member of several international organizations on transparency and as a consultant to the State Department, World Bank, and the Inter-American Development Bank. Before joining the Carter Center, Ms. Newman served as an attorney representing persons living below the poverty line. She earned her bachelor's degree in international relations and her law degree both from the University of Wisconsin in Madison. Laura, look forward to hearing from you too.
Thank you, Shem. It is an honor to virtually be here with all of you. I appreciate your allowing me into your homes and offices, or in many cases, your home offices, and I hope that you have all been healthy and well. At the Carter Center and in the Rule of Law program, we have remained busy. This morning, I'm particularly pleased to share with you our progress on the upcoming launch of the Carter Center's Inform Women, Transform Lives campaign. For many of you who have been attending Board of Counselor meetings for some years, you may recall that the center has been working to advance the fundamental right of access to information for over 20 years. But about 10 years into this work, we realized that women largely were absent. This was surprising because, as the saying goes, information is power. and a genuine right of access to information is particularly important for women, as it allows for more effective decision-making regarding education, economic empowerment, business opportunities, health, and the promotion and protection of other rights. It also enables women to participate in public life, have meaningful voice, and hold governments and service providers accountable. We suspected that women may have been less present because of inequities that she faces when trying to access public information or services. At President Carter's urging, we did a multi-country study that demonstrated that, in fact, women are not able to exercise their right to information with the same ease, frequency, or rate of success as men. Despite the over 125 countries with access to information laws, the benefits have not reached many women because of a web of factors, including fear, lack of awareness, poverty, illiteracy, and insufficient time and mobility. In response, the center began programming in 3 countries to support government and civil society to advance the right of access to information for women. And we convened an international conference to consider the significant disparities and inequities and to develop a series of suggested actions. To deliver on the conference recommendation to increase awareness of the challenges that women face and to demonstrate the value that public information can play for women, their families, and their communities, the Carter Center developed the Inform Women, Transform Lives campaign. This is the first ever campaign of its kind. Initially, we were planning to work with national governments on the campaign, but after reviewing the more than 600 requests for information that we have assisted women in making, we realized that the information most valuable to women is the most local. So we switched our focus to work globally and at the city level. The objectives of the campaign are to raise awareness about women's right of access to information, to help cities reach women with information related to municipal services, public benefits, and how to participate in local government decision-making, to increase the number of women accessing this information and to demonstrate the impact it can have, and ultimately to influence global policy to more explicitly include women's right to information. To begin the campaign, President Carter sent a letter to 30 cities inviting them to apply to be a part of the inaugural cohort. We recognize that this was coming in the middle of COVID, when cities have been hit the hardest, and so we hoped that we would at least get a few interested cities. To our surprise, more than half of those invited sent in an application. An expert selection committee reviewed and ranked the cities, and ultimately we chose the top 13. As you can see, these represent major cities from Africa, Asia, Europe, and North and South America. The campaign itself has 8 components. The media component will be used by the center and the cities to raise awareness generally about women's right to information and how information can support women to access municipal services. This will include animated videos, billboards, posters, public service announcements, and social media posts for Twitter, Instagram, and others. A core component of the campaign will be the city's efforts to assure that women receive information about their chosen theme. Over the past 2 months, we've been working with each of the cities to identify services or programs that they have, but that women are not accessing because of a lack of information. Each city is selecting a topic that is important for women in their community. And in addition, they are sometimes selecting a subpopulation of women or a specific part of the city to target. I'm thrilled about the diversity of ideas and the incredible commitment of the cities. In some of my remaining time, I would love to share with you the plans of a few of these amazing leaders and their teams. For example, in Chicago, they have a program called the Chicago Key. It's a card that serves multiple purposes, including being a valid identification card, providing access to public services such as transportation and libraries, reduced cost pharmaceuticals, and others. The key is free and targeted toward low-income families, homeless, and women survivors of domestic violence. But unfortunately, a lot of people haven't heard about the key or been able to get it. Through the Inform Women, Transform Lives campaign, we are working with Chicago to disseminate more information to women, particularly women of color, about the key, how to apply, and its benefits. Together, we will track the number of women who get the key and how it is used in order to show the impact that this information and the key itself can have. In Amman, Jordan, the mayor and his team decided to focus on women's economic empowerment, particularly for those women with cottage industries where they make food and crafts in their home for sale. This is super important at this point because, well, often women aren't allowed out of the house, and now with COVID, it's even harder for women in Amman. But a license is necessary in order to legally sell homemade goods. The city provides this license, but haven't seen many women requesting it. Through the Inform Women Transform Lives campaign, the City of Amman will be focusing on areas where the most marginalized women live to provide information about training opportunities, how to apply and receive the license to sell goods from their homes, public spaces where they can safely sell goods, and even the potential for small loans. In Monrovia, Liberia, they're focusing their campaign in the slum areas. After a number of internal consultations, the city came to us with the idea of focusing on solid waste management. Garbage. At first, I was a bit skeptical, but as they explained, in the slum areas, women are burning or burying their garbage or throwing it into the river. This is causing poor air quality and serving as breeding grounds for mosquitoes, which in turn leads to increases in malaria. The city wants to share information with women in these communities on where they can safely dispose of their garbage, how they could recycle or compost their garbage, and even how they could start their own small enterprises collecting garbage for the city and making money. In Colombo, Sri Lanka, we were told that an estimated 90% of women have been harassed, threatened, or attacked in public spaces, particularly public transportation, but that only 4% have ever made official reports. The city's mayor, the first time they've ever had a woman mayor, believes that there's a lack of information about women's rights in public transport and what they can do if these rights are being violated. The city developed a mobile safety app for women, but few are aware of it. Through the Inform Women Transform Lives campaign, the City of Colombo will share information about women's rights to safety and about the new app. In addition, they plan to highlight jobs that are available for women to serve as bus drivers and conductors, and how they can apply for these positions, with the hope that if more women are driving the buses, it will be safer for all female passengers. Perhaps one last example. In Guatemala City, the municipality runs women's centers that provide free health care, nutrition, legal support, and job training. These centers are located in the poorest parts of the city. While they're open to all women, the city found that almost no women under age 35 are using the centers. Through the Inform Women Transform Lives campaign, they plan to raise awareness about the centers, their locations, and the many services available. As you can see, I'm super excited about how these cities are using the campaign to increase women's economic empowerment, safety, and well-being, truly demonstrating the transformative impact of information. To further support the cities, we have developed a resource guide and have been holding weekly roundtables and will continue to provide opportunities for peer-to-peer learning. Additionally, we will be engaging civil society organizations in each city through a competition for small grants, and will seek to leverage all of these experiences to influence policy change. The campaign will officially launch on March 8th, International Women's Day, and will continue until September 28th, International Right to Know Day. On the launch day, we are working with the cities on creative ideas that can highlight the campaign even during COVID. And we will have an opportunity for people from around the world to come to the Carter Center website and pledge to create a world in which all people can access information to transform lives. But we could use your help. As members of the Carter Center's Board of Councilors, it would be wonderful if on March 8th you told your friends and colleagues about the campaign, shared messages on your own social media, and made the pledge to serve as a champion for women's right to information. Thank you for your continued commitment to the Carter Center and for your support of our work. I look forward to being back here again in the future to share all of our successes in the Inform Women Transform Lives campaign. Thank you.
Thank you, Laura. I am so excited about the Inform Women Transform Lives campaign initiative and really looking forward to you rolling it out and seeing all the success that comes along with it. And let's move on to Nathan Stock, who has served as a consultant and project manager for the Center's Domestic Political Violence Mitigation Project since last year. But his affiliation with the Carter Center began in 2008. Mr. Stock is an adjunct instructor at Furman University, where he teaches on conflict assessment and prevention, intergroup dialogue, and leadership for social justice. He is also a non-resident scholar with the Middle East Institute. Mr. Stock served as the Carter Center's field office director for Israel-Palestine, overseeing programs in Israel, the West Bank, and the Gaza Strip from 2013 to 2017. Prior to that, Mr. Stock served as an assistant director in the Center's conflict resolution program. Before joining the Carter Center, among other posts, Mr. Stock served as a program coordinator promoting civil society in Kabul, Afghanistan for Counterpart International. Nathan earned a bachelor's degree in international relations at Colgate University, and a master's in international peace and conflict resolution at American University's School of International Service. Nathan, we look forward to hearing your remarks.
Thanks, Shem, and good morning, counselors. It's a pleasure to be here. My name is Nathan Stock. I'm with the Center's Conflict Resolution Program. We just finished a 5-month project where the Center was able to experiment with applying some of the methodologies that we use to address armed conflicts abroad to polarization and other threats of violence around the recent U.S. elections. There's not time this morning to review everything we did, but I'd like to share a few key highlights over the next few minutes. First thing to note is that this project only began September 1st, which did not give us a lot of time with the presidential election coming November 3rd. Our first task was to figure out which communities in the U.S. might be at increased risk of unrest around the election. We believed that by looking at past patterns of violence and public protest, we could roughly anticipate which communities might be hotspots around the November election. So, working with Princeton University and an excellent data analyst, we began to aggregate a variety of publicly available data sets. In particular, we looked at data on police shootings, militia activity. We went back to the 2016 presidential election results by county. We looked at demographic info and more, and aggregated all of this into an app, such that by the first week of October, this analysis had generated a list of 27 U.S. counties that we saw as being at somewhat increased risk of unrest around the November election. Most of these were counties that were home to smaller, liberal-leaning cities in close proximity to more conservative rural areas. Portland, Oregon is a good example of this phenomenon. We also had a few larger metro areas, including Atlanta and Dallas, places where you had suburbs that were more politically mixed between liberals and conservatives. The Carter Center recognized that we didn't have the resources to work in all 27 of these communities. So we strategically reached out to other national organizations, civil rights organizations, human rights organizations, national dialogue organizations. We shared these findings with other nonprofits that we hoped would have some resources to engage some of these potential hotspots in advance of the election. In parallel, the conflict resolution program settled on 4 locations where we decided to try to engage directly. We chose Raleigh-Durham and Charlotte in North Carolina, Atlanta, and Pittsburgh, Pennsylvania. And the idea in each of these communities was to see if we could engage local community leaders who we could convince to work with us proactively before the election to help make their communities more resistant to possible violence or other disruptions to the electoral process. By this point, it was mid-October. The clock was ticking. We very quickly sent out emails and made phone calls in these communities, and we began to pull stakeholders together. We engaged a number of faith leaders, heads of local nonprofits. We worked with the former mayor of Charlotte, and we ultimately pulled together a series of workshops via Zoom. So each community, one for Pittsburgh, one for Charlotte, et cetera, had a Zoom workshop with the stakeholders that we were able to bring together in this very rushed process. In each of these workshops, we did the same things. We started out by sharing the risk profile that our database had developed for a given community. So you can see here the unique risk profile for Fulton County. This is where Atlanta is located, right? This just lays out how the violence risk factors in our database compared for Fulton County versus other counties in the data set. So we shared this analysis, and then we tried to build some consensus with our participants. We tried to understand to what extent they were concerned about possible violence or other disruptions of the elections. Who did they think might be victims of this violence? Who might be perpetrators? And as we built this consensus, then we tried to work proactively to empower these community leaders with the idea that we could get ahead of this, that as influencers in their communities, they could be issuing positive, proactive messaging that might make violence less likely. As part of these workshops, we shared a series of talking points that the Carter Center had put together. A number of these messages focused on electoral integrity. These were put together with help from our Carter Center colleagues who work on elections. We shared key messages designed to bolster confidence in the electoral process, as well as specific messages designed to push back against violence. We engaged with a very active interfaith group in Pittsburgh, including Jewish, Christian, Muslim, and Hindu leaders. This graphic illustrates a customized social media message that this interfaith group in Pittsburgh put together. They took our generic content and translated it into Pittsburgh themes. It turns out that Heinz ketchup was invented in Pittsburgh. They put together a whole series of these social media messages and released them on a regular schedule up to and after Election Day, November 3rd. So that summarizes a lot of what we did, at least in a few swing states before the presidential election. After the presidential election, with the Senate runoffs looming in Georgia, we refocused most of our efforts on Georgia and went through a somewhat similar process. In Georgia, we particularly engaged a lot of faith leaders. And here I have to thank our former BOC chair, Ann Kramer, for making so many helpful introductions. But the basic work was similar. We pulled together a couple of Zoom-based workshops, mostly with faith leaders in Georgia in December. We put together customized messaging for these faith leaders and others, and made the same underlying argument that we could proactively, working together, put out messages that could strengthen norms in our communities in favor of democracy and in opposition to political violence. This last slide shows you some of the social media content developed by Carter Center Communications that was shared with faith leaders in Georgia. I just want to underscore the underlying theory behind this work was that by identifying trusted figures in these communities, the Carter Center could help them make violence around the elections less likely. We knew from the start that this modest, rushed project could only begin to address some of the challenges facing U.S. democracy, but nevertheless, we're encouraged by our results. The Carter Center had never done work of this nature in the United States. We had little to no contacts in most of the communities we engaged, and yet, time and again, virtual strangers were willing to volunteer their time to work with us on this. That's a good sign. We were also encouraged by the fact that our ability to marshal data, quantitative data, and qualitative conflict analysis, something we use so effectively in our work abroad, also was very helpful in engaging on these issues here at home. Finally, one of the things we do so well on conflicts internationally is convening, engaging stakeholders from senior elected officials to grassroots activists. And here again, we found that this ability to open doors and engage was helpful here in our domestic context. So, to sum up, we're under no illusions about the challenges facing our country. These challenges are immense, and the Carter Center certainly doesn't have all the answers. But the experience of this pilot project does suggest that we can contribute to solutions here at home. Thank you.
Thank you, Nathan. It's sobering that the United States should have to focus on political violence, but with the events of January 6th, we are thankful that the Carter Center is taking this important issue head on. Now we're going to make a set change for our group discussion, and let me take the opportunity to introduce our panelists and my good friends, Paige Alexander and Jason Carter. First, Paige joined the Carter Center as CEO in June 2020, continuing a distinguished global development career with over 2 decades of experience spanning the government and nonprofit sectors. Paige held senior leadership positions at the United States Agency for International Development, otherwise known as USAID, during 2 presidential administrations. In her highest role with USAID, she led the Middle East and North Africa Bureau, overseeing more than 1,000 employees, programs in 12 countries, and a budget of more than $1.4 billion. Between her assignments with USAID Paige was Senior Vice President and European Founder President of IREX, an international civil society, democracy, and education nonprofit. Before her appointment to the Carter Center, she served as Executive Director of the European Cooperative for Rural Development in Brussels and Amsterdam, two of my favorite cities, working to improve the livelihoods of farmers, families, and communities in Africa. She earned her bachelor's degree in Organizational Communication and Social Psychology from Tulane University Newcomb College. I am also pleased to introduce my friend Jason Carter, Chairman of the Carter Center Board of Trustees. Jason is a partner with the law firm Bondurant, Mixon, and Elmore. He served in the Georgia State Senate. He is a trustee of the Georgia Bar Association. He's a former United States Peace Corps volunteer, having served in South Africa. He's also a former Carter Center intern, and he's the first grandchild of Jimmy and Rosalind Carter. Well, we finished our set change, and now it's time for our fireside chat with both Paige and Jason. So I'm going to kick it off with a question for Jason. So tell us about your grandparents, how they're doing, and we'd love to hear what it's like being chair in the middle of a pandemic.
Thanks, Sham. It's great to see you as always. My grandparents are doing great. They are down in Plains like everybody else. They're in essence stuck at home, but they're doing well. We saw them, of course, like everyone else in the world, only limited ways in the last year. But we were down there in December with my kids and spending time with them. And they've watched the impact of the pandemic. They've watched this political moment in our history with the same kind of concern and worry that a lot of other folks have. And, I hear from them a lot. My grandfather will call me on my cell phone, every once in a while and just talk. But one of the things that they're happy about right now is the state of the Carter Center. It really is a moment where we are undergoing both a great, positive change at the center, and that's seeing not just new board members. We dramatically diversified our board this year. We added 4 new board members that are remarkable people with health expertise, with some deep Africa experience, with communications expertise, that are well respected around the world. Of course, we brought in Paige in the last year. And frankly, since Paige has come in, we've brought in new substantive leadership over both the health and peace programs that are going to be really exciting people that are going to drive it into the future. And I think it's a really happy time for my grandparents because as they prepare for their 75th wedding anniversary this year, which of course is totally absurd. It's like winning 7 Super Bowls. But they know that their legacy is in a good place. They know that the Carter Center is not only solidifying and building on what they have achieved, but we're charging into the future in a really effective way. So I'm excited about it. As you can see, part of that has to do with the dynamic leadership that Paige is bringing. But this is a great moment in the history of the Carter Center.
Oh, that's so great to hear. Now, did I hear through the grapevine that President Carter is swimming a lot? On his 75th wedding anniversary, is he turning into an Olympic swimmer?
I don't know if he's going to make the Olympics, but he has definitely, he had this really serious fall a year and a half ago, and he's been struggling to recover from that physically. Mentally, he's doing great. But yes, part of what he's doing now is he's swimming. He's walking every day. My grandmother is getting around great. And, part of the problem that them being so close to home is they can't quit solving problems. And so, half the houses that were affected by the Habitat for Humanity in Plains are getting new roofs. They're raising money for all these variety of things in their little hometown. So they're still driving their own way, the way that they always have. They're just doing it like everyone else in a slightly smaller circle, but they're doing good. Yeah.
Yeah, that's so great to hear. So great to hear. Well, let's move to you, Paige. So, I think what's on a lot of people's minds is how is the Carter Center actually fulfilling its mission in the middle of a pandemic all across the world? I mean, you have over 3,000 employees from disparate backgrounds with different skill sets and expertise in the far reaches of the world, right? But we're in the middle of a pandemic when you can't interact with each other. You have to socially distance. You've got all kinds of logistics issues. So love to hear about what's going on that front.
Yeah, I think the resilience of our staff is something that has been really wonderful for me to walk into. I was actually I was looking at my calendar and realized it was a year ago that I was down in Plains with you, talking to President and Mrs. Carter and having pimento cheese sandwiches, and no idea that we were going to walk into a global pandemic. So we were headed in the direction of the continuity of what the center's always been. And then COVID hit, and racial injustice, and all of the issues that we've been dealing with. So the resilience of our staff has been remarkable. We have fallen back in mass drug administration in some places, in Nigeria and others, and we don't know what that will mean. But as soon as WHO allowed us to be on the ground, we were on the ground again. It's been really remarkable. We've had great changes for guinea worm, because we do work at a local level. I had watched every weekend an interview that Melinda Gates had done with David Letterman, and in that conversation, she says the best advice she ever got was from President Carter, where he said, it has to be local, it has to be locally owned. So even in the middle of a global pandemic, when you're looking at developing countries and developed countries suffering with some of the same issues that we never thought would be at our doorstep, we've got local people who work with us who are continuing the activities. And for that reason, it's been wonderful. At the same time, we bring the technical expertise of trying to find innovations and new ways to do things. And so whether it's guinea worm and using drones to affect changes on the pond so we get to the copepods, or whether it's in doing election observation in Cote d'Ivoire and Myanmar and other places in a different way than we've done it before, I think that there's been a lot of pivoting. So as I like to say, with these challenges come some great opportunities, and the staff has really risen to that occasion. And so it's an exciting time to be strategic and figure out how we can keep doing this important work.
And if I could just tag onto that a second, there's a couple of things. Number one, we sometimes forget, the Board of Councilors, which is an Atlanta-based group, forgets that of those 3,000 employees, we have almost as many, or maybe more, I think, in Ethiopia than we do in Atlanta, right? And so we're talking about a truly global organization. And when you confront issues in some of these places, it almost brings people together to be dealing with this pandemic, right? Everyone is learning in the same way. In the United States, we have a different set of resources, but you're still able to bring people together. As I think, and you correct me if I'm wrong, but as sort of our global staff has seen the United States confront a series of issues, it has helped some of the dialogue and some of the virtual aspects of this moment have improved some of the communications that we have with our global staff out in the field. I think it is an interesting moment. Of course, it's got serious problems, and as she mentioned, it's bumped back some of the mass drug administration and some of the other things. But we have discovered new ways to fight through these problems and new tools that we're going to use to do it.
Yeah, that's such an interesting point, because there are so many things the Carter Center has done globally, and if very effectively, whether it has to do with vaccine distribution and deployment to bringing healthcare to rural communities. In light of the pandemic, the innovation that's coming out of whether it's being constrained due to government shutdowns or social distancing or whatever, I'm going to tap into some of your substantive experience. I know both of you are executives and leaders, but at the same time, you got here because of a lot of the stuff you've done from the time you entered your professional career to now. What are some of the learnings from our foreign work that can be brought to the U.S. to help with some of the pressing issues that we're facing today, whether it's on the civil society front or on the healthcare front?
Do you want to take that one?
So I'll start.
Yeah.
So just the flexibility that we have at the Carter Center, because we have such an amazing donor base, because people rely on us to sort of be good stewards of their funds as well as our program activities. I think it allows us to take our international experience, and when we did, as Nathan talked about earlier, and as Laura Newman's talking about with Inform Women, Transform Lives, we can do that in Atlanta and Chicago, as we're doing here, as well as overseas. And I think that flexibility that the Carter Center offers is so different than being part of a U.S. government donor organization or being reliant on funding that comes from a certain space. We have that flexibility, and together with the board and strategic thought processes coming from staff, we actually have been able to do some interesting things because we recognize what happened internationally and what we can parlay to do here.
Yeah, I mean, I agree, and I'll just say that it is frequent that someone says, "Well, you know, your expertise in health, your mass sort of public health work, your democracy work, you know, why is that relevant to the United States?" we
I
hear that
know.
all the time.
I know. Who would have thought? You know, with you being new here and giving your, I mean, there's great rapport that both of you have. So, tell us a little bit about how you two are working together as a team and what you're doing to collaborate with one another to continue to move the Carter Center forward.
Well, let me start there since Paige started last time. We have one of the things that's true for me right now is this giant building is empty, and everyone's working remotely. I'm working remotely in a house that has multiple children learning from home.
Right.
My wife is, until very recently, she's a teacher at Grady, soon to be Midtown High School, and until recently she's been at home as well. And so there have been moments where I have come, to here to do it. I have an office upstairs to do a little bit of work, maybe a court hearing or something where I can't have my dogs barking in the back. And I think that has been one of the aspects of this moment that's great, because she and I will see each other distanced across the room, et cetera, but really have opportunities just to bounce ideas off of each other in good ways. And I think we've been doing that in a really effective way.
Yeah, and for me, as Jason says, this place is empty. I do come in every day. I loved working at my parents' dining room table when I first got here in June, but decided that perhaps it would be better if I were in the office. And having that interaction, the one-on-one interaction I have with staff on screen, still gives them a sense that I'm here and gives me a way to get to know them. Because when everyone shows up with masks on, I think at all of our works, it's going to feel very different. You miss the body language. So with Jason being just right across the hall sometimes, and it's a good way to have these conversations on a one-off basis that allow us to have more of a rapport than I think we would have otherwise.
Yeah, I think the serendipitous interactions are so important.
Yeah.
Well, I am excited that you two have seized the moment in so many ways, along with the 3,000 plus employees of the Carter Center. We're clearly doing some incredible work. With that, I'd like to kick it off to the audience. We had a few questions come in via video that were directed to both of you. So let's move to those questions from our BOC members.
Good morning, Jason, Paige, and Sham. I'm Ann Kramer, and I would love to ask a question about any engagement in domestic issues within the United States. The global learnings have been so amazing, and the issues that we face often in this United States are similar to some of those challenges that you've so bravely challenged all over the world. So I would love to know, what if there are issues that are to be considered and or situations that could be considered in which the Carter Center would be totally involved in those issues in our country, domestic issues. Thanks so much. I love seeing all three of you.
And so thanks, Ann. Always good to hear from you. And we have some really interesting partnerships. I think that we're under no illusions that over the period of the 2020 elections that these challenges are going to go away. So the question is, what do we as an international organization do domestically? And we had some great successes in the 2020 election. We had over 45 national media interviews. We had hundreds of millions of impressions and hits on our website for all of the work that we did for transparency. And I think for us, that's a lesson that we took from our international experience. But we're looking in two main areas to figure out if we can be, as President Carter said, be bold but be unique. And there are a lot of people who have the wherewithal to do domestic programming. But we have a great partnership with Cure Violence and Bridging Divides and the ADL and St. Luke's, where Ann is from. And to be able to have those partnerships and figure out what comes next is important. And to take things like digital threats that we've seen overseas on misinformation, how does that stream through our programs here, and how does that affect our partners in the field? We have a moral obligation to hold our country accountable to what we do overseas as well. So those are areas we're going to be looking into. I'll be looking to Jason and the board to help us strategically figure out where we can plug in. So excited.
And I'll just note from the board's perspective, we have to ensure that we can meet our own standards. And one of the biggest issues that we have as a nonpartisan organization, we know that we're neutral. Around the world, we're seen as neutral. In the United States, we have to build that reputation of neutrality even more. Obviously, we're led and founded by President Carter, who is a Democrat. But this organization has always been nonpartisan. And as we've built partnerships and as we continue to build that out, that's going to be an important part of any of our domestic work.
More questions?
We do. We actually do. We have a couple more questions. Let's go to the second one.
Good morning. Tommy Barrow, Decatur, Georgia, and longtime BOC member. Jason, my question concerns Myanmar and the recent military coup. I know the Carter Center has been involved in Myanmar for some time. How do you envision your work going forward in light of the coup?
Thank you, Tommy. This is a complicated question. As you know, you joined us in the Carter Center's election observation mission in 2015 when I led that mission along with the great Mary Robinson. That country is a complicated one. That transition, even in 2015, the election was a only partial releasing of power from the military. As you may recall, in that 2015 election and in the current Constitution, the military reserved for itself a quarter of the parliamentary seats, which allowed them effectively to veto any constitutional changes. And the military also held on at that time to the ministries of defense, the ministries of the border, and essentially Homeland Security. And so the military over these last 5 years has been in this power sharing agreement with this slight edge towards democratization. And what has happened after the 2020 election, which the Carter Center also observed in limited ways, they have in essence decided that that's not enough for them. And what we are able to do as we look forward and continue to observe what's happening in Myanmar is to continue to use our past history, the credibility that we have, and sort of the good offices of the Carter Center to continue this democratic dialogue that's been ongoing. This particular coup does look a little bit different than the absolute iron fist that has come down in the past in Myanmar. As they've had elections and as they've embarked over the last 5 or 6 or 10 years, there have been real changes on the ground. And I think it appears that the military understands that. But we'll really have to pay close attention on a personal level. The Carter Center staff has stayed on the ground in Myanmar over the last several years, since you and I were there in 2015. And that group has had serious security concerns over the last few days. They have had their internet reestablished. We have had real contact with them. And we think that they're in a safe place right now. But watching what happens in that country is going to be crucially important. We think this is a different moment than it has been in the past. We're still hopeful that the path to democracy will continue, but the Carter Center will certainly be there using its good offices to do what we can to communicate with the military and others on the ground to continue that path toward democracy. But no doubt this is a serious moment for everyone to pay close attention to Myanmar.
Yeah, I got to say, I know we're friends and I'm biased, but it is really good to see the Carter Center expertise rise all the way up to the level of the board chair. That was fantastic. But to the earlier question I asked, I think it's great to see the passion at that level, but especially since you two are collaborating so much, and I think that rapport and the conversations that you have will continue to move the Carter Center in really new and exciting directions. So I really appreciated learning a little bit about Myanmar right there.
No problem.
Well, let's move on to the next question. We have one more.
Hey, Sham. It's your old friend, Laurie Speed. I'm excited about joining the Board of Councilors. I had a question about what the expectations were for us as board members from the Carter Center.
Thanks, Laurie. It's so great to have you joining the BOC. Laurie and I go way back to college. We first met when we were 18 years old. Yeah. But anyway, welcome to the board and to the rest of our new members. So we really only ask two things, and that's to attend meetings and to promote the work of the Carter Center. But I'm going to take advantage of my executive privilege here and say that the board really consists of a number of people with incredibly influential networks. And I think there are lots of different ways that counselors can engage with the Carter Center by just thinking about who's in their networks and not only advocating what the center does, but also making connections. So to the extent you can you know of something that could be beneficial through a strategic relationship or just an introduction, then by all means, I would encourage you to reach out to Jason, to Paige, myself, and hopefully we can continue to expand those coalitions that have really made the Carter Center one of the most relevant, important organizations in the world.
Thanks. And I'll just say, I was going to claim Lori Speed as an old friend too, but I haven't known her as long as you have. I do think it's really important for people to understand how valuable it is to the center and how valuable the Board of Counselors has always been. Those relationships, those connections, the promotion of the center, particularly as we move into this sort of new phase of its existence. Having people understand that here in our hometown, we have this organization that is a giant organization with thousands of employees around the world tackling some of the most relevant, important issues. That being that public face for us in your spheres of influence has always been crucial, remains crucial, and we just appreciate you all.
Thank you, Jason.
Thanks,
Thank you, Paige. This has been a great conversation and looking forward to the next meeting. Again, hope you guys have a great rest of the week, and we look forward to seeing you next time.
Thanks so much.
Thanks.
Before I close, I want to remind you of 2 items. First, looking forward to seeing you at the next meeting of the Board of Counselors on Friday, June 18th. And as counselors, we ask you to continue to attend meetings and proactively support the center in those circles in which you have influence. Thanks again, and see you next time.